beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
Hansen and Spross, 1966, developed the following definition of collaboration based on literature reviews and clinical experiences. Collaboration is a dynamic, interpersonal process in which two or more individuals make a commitment to each other, interact authentically and constructively to solve problems and to learn from each other to accomplish identified goals, purposes, and actions. The individuals recognize and articulate the shared values that make this commitment possible, as cited in Hansen and Spross 2009. Collaboration implies partnership, commitment, similar values and goals, but also permits differences of opinion.
My name is Summer Thomas, and I'm going to talk about Hamrick's integrative model of advanced practice nursing. That is the framework that we use for the collaboration core competency. Hamrick's integrative model of advanced practice nursing is one of the first models that was formed to apply to all advanced practice nursing roles. It consists of 3 theoretical definitions that go as follows: graduate education, certification in the specialty, focus on clinical practice with patients. It also consists of 7 core competencies: direct clinical practice, collaboration, coaching and guidance, research, ethical decision-making, consultation, and leadership. Collaboration is the core competency discussed in this presentation, so I'm going to go in a little bit more detail how it applies to Hamrick's integrative framework. It is performed in conjunction with other competencies. It is accomplished in several different manners. It can be accomplished among individuals, in work groups, and in organizations. The best health quality outcomes are achieved using collaboration.
My name is Julie Brown, and I'm going to discuss the first 4 characteristics and traits of collaboration. Clinical competence and accountability. Clinical competence is extremely important in collaboration. If one colleague does not trust the other due to incompetence or unsafe practices, it will cause a strain on the relationship between colleagues and it will ruin the rapport of the office. When colleagues do respect and trust each other's judgment, it immediately increases patient care due to being able to ask others' opinions and experiences. Accountability of a person shows character traits that others can see. In collaborating with others, one wants to feel secure that their colleague will take responsibility for their actions and their part in forming a successful practice. Common purpose. The basis of collaboration is to have a common purpose. If colleagues form together and do not have the same result in mind, there will be a conflict and the goal may not, if ever, become accomplished. Colleagues should decide in the beginning of their relationship what their main goal is before starting. This establishment will save time and money and will provide better care for patients. Interpersonal competence and effective communication, including assertiveness. In order for any relationship to be effective, each member has to have interpersonal competence and needs to have effective communication skills. These are especially important in the case of a disagreement. Each colleague should feel competent in their role and be able to communicate the reasons why they disagree and openly talk about it and come to a compromise. Assertiveness is sometimes needed in collaboration for someone to show their competence to another colleague. Trust and assertiveness intertwine. Once trust is established, the ability to communicate about delicate topics increase. Trust and respect. Trust and respect build over time, but it is the key component to collaboration. Two colleagues do not always have to agree with each other, but they do have to trust one another and respect one another in order to collaborate effectively. Although if two colleagues do not have this trust and respect, the relationship is unhealthy and the consequence will be broken collaboration and could have an effect on the patient care.
Hi, I'm Amy Norcross, and I'm going to discuss the next 3 characteristics and traits of collaboration. The first one is mutual respect. Development of trust and respect depends on clinical competence. Respect for others' knowledge and practice is key to successful collaboration because it enhances shared decision making. The next one is recognition and valuing of diverse complementary knowledge and skills. This enhances one's own personal plan for patient care. Key components are appreciation for the diverse and complementary knowledge of each party, a commitment to quality and patient-centeredness, and a willing to invest in the partnership or team. These components are necessary for collaboration to become the normative process in team interactions, and as a result, partners observe that patients benefit from their combined talents and efforts. The last one is humor. This decreases defensiveness, invites openness, relieves tension, and deflects anger. Positive and non-threatening humor helps to keep perspective and acknowledge the lack of perfection. Humor helps diffuse difficult situations and allows for colleagues to refocus on working together to meet common goals.
I'm Monica Tracy, and I'm going to discuss examples of collaboration. The first one is going to be between the advanced practice nurse and the patient. The first thing that needs to happen is to determine how the patient intends to work with the advanced practice nurse. There needs to be goal setting, and there needs to be determination of any barriers that might prevent the patient from adhering to those goals. The second example would be between the advanced practice nurse and the organization. The organization is going to have explicit mission statement as well as goals, and this can be a starting point between the advanced practice nurse and the organization in developing a common purpose together. Thirdly would be between the advanced practice nurse and the physician. Although this might be the most common one that we think of, it can sometimes be the most difficult as well. There needs to be mutual trust and respect, also acceptance of each other's discipline, and to know that neither are trying to be substitutes for the other. And lastly, between the advanced practice nurse and the nurse researcher. This is so that through the collaboration, they can implement evidence-based practice changes in order to improve overall patient care.
Hey, my name is Eric, and I'm going to be talking about an example of collaboration. When I think about collaboration, I think of two things. One, the Krebs cycle. Who doesn't remember how challenging the Krebs cycle was in microbiology? A friend said it best though. Who isn't happy that there's someone in a laboratory that's so excited to get a lab value out of a microscope, and that we can actually focus on diagnosing patients, which gives us more time with our patients? Collaboration. Also, I think of my favorite movie, The Incredibles. Who could forget Buddy Pine, the villain that had to be defeated at the end of the movie? But it wasn't just Mr. and Mrs. Incredible, it was actually Violet, Dash, and Frozone that also helped. Another example of collaboration. Well, that's what I want you to think about with collaboration. In Hansen and Spross, they talk about how the collaborative relationships are not only professionally satisfying, but also improve the access to care, and they can help improve those patient outcomes. When you think about the actual cycle of patient outcomes with collaboration, you think of the nurse practitioner or the advanced practice nurse diagnosing. You think about the person in the laboratory that helps look at those laboratory values, the surgeon that's so excited to do surgery, the pharmacist that's able to help us prescribe the most efficient product for that client, and then the PT person that gets that patient up and running. And that all equates to that happy patient at the very end. So, in paraphrasing Hansen and Spross in 2009, you see that by increasing the expertise and the sharing of all those resources, we can not only increase the mutual trust and respect we have with patients, but we can also increase the patient satisfaction and provide a more optimal patient outcomes. And in closing, I just want you to remember The Incredibles. Your group too can do great things.
Hi, my name is Amanda Atkinson, and today I'm going to talk about the research part of collaboration. The big question when it comes to collaboration is, what does the research and evidence-based guidelines say? Well, according to Hansen and Spross, research on collaboration has not been definitive, but does provide evidence to support the premise that better patient outcomes are a result of collaboration. In research studies on collaboration, there is a lack of systematic measurement of patient outcomes. Despite this, benefits to the patient and provider have been documented in works by Lideker, Sullivan, Torres, and Dominguez. Positive patient outcomes have been identified in studies focused on the impact of advanced practice nurses on management of disease and interventions for care transition. In such studies, collaboration is applied, but it hasn't been specifically identified or measured. On the next slide I'm discussing is benefits of collaboration. The focus and point of collaboration is what are the benefits provided to our patients. For our patients, it improves their quality of care, increases the patient satisfaction overall. There's a lower mortality rate, improved patient outcomes, and the patients feel more secure, cared for, and closer to their nurses. The benefits of collaboration are also been shown for providers that it increases the sharing of responsibility, it increased sharing of expertise, more mutually satisfying problem solving between providers. There are improved communications, increased personal satisfaction in their jobs and daily work lives. It increases the quality of professional life. It creates an enhanced mutual trust and respect between the physician and the providers and the nurse practitioners. It also has bridges care-cure dichotomy and expands the horizons of providers. And it also avoids redundant care and ensures coverage. And the basic point is it empowers providers to influence the current health policy.
Hi, my name is Edwina Ely, and I'm going to begin by discussing and expanding on the outcomes of collaboration by discussing specific research studies. The National Joint Practice Commission Demonstration Project was one of the first studies to record the patient and provider benefits of collaboration. This study indicated that collaboration produced enhanced communication and better patient outcomes. However, unfortunately, this work went unfinished. A study by Cowan and colleagues compared control patients who received usual care by primary care physicians with hospitalized patients treated with physician and nurse practitioner teams. Results showed that multidisciplinary care management shortened the average length of hospital stay, which resulted in lower hospital costs without altering the rates of mortality or readmissions. Another study by Lideker and colleagues examined the care that physician and nurse practitioner teams provided to patients with diabetes and hypertension compared to the care provided to these patients by usual physician care. Findings included higher one-year cost, clinically and statistically significant improvements in hemoglobin A1C levels and HDL levels, and significant improvement in satisfaction with care and quality of health. It was concluded that non-physician professionals are effective and add value in collaborative management of chronic disease at modest cost increases. A study by Ruddy and Ree provided evidence that transdisciplinary teams providing care to underserved benefited these populations. A study by Sears, Maxwell, and Townsend revealed that nurse practitioner and physician collaborative care lowered the frequency of urgent care related visits to a geriatric primary care clinic. And finally, Jackson and colleagues conducted a study comparing collaborative management by certified nurse midwives and obstetricians with the usual physician-based care. The certified nurse midwife and obstetrician collaborative care resulted in more normal spontaneous vaginal deliveries, less epidural use, shorter lengths of stay, and higher numbers of breastfeeding at discharge.
Thank you for your participation and your attention during our presentation. Listening to collaboration and the essential part it plays in the daily lives of healthcare professionals is really what's going to lead to optimal healthcare opportunities for our clients that we serve. Overall, this competency of collaboration benefits all professions in the healthcare industry. A dynamic partnership with shared accountability, mutual respect, that trust and aspiration to promote optimal care for the client is what is essential to promote successful collaboration and client care. Again, thank you on behalf of our team, and good luck to you guys the rest of the semester.